Hello, everybody. I'm Chris Gotti, Chair of the Department of Public Affairs at Mayo Clinic, and I'm thrilled to join you here today from the World Economic Forum in Davos, Switzerland, and thrilled to be with Dr. Gianrico Farrugia, the new President and CEO of Mayo Clinic. Today we'll discuss the need for innovation, the future for healthcare, and also what's ahead for Mayo Clinic. So let's get started. Dr. Farrugia, your time at Mayo Clinic has been marked by not only being a physician, but also an innovator, a researcher, and an educator. But you're also now obviously the president and CEO. From your viewpoint, how is Mayo Clinic positioned to transform healthcare, not only in the United States, but also globally?
Well, thank you, Chris, and welcome everybody. For me, it's a pleasure to be here in Davos, to really have an opportunity to work with others, to try and come up with new solutions for the challenges that face healthcare. And Chris, you know this very well. There are challenges that everybody knows about because they've been there for a while. So healthcare continues to be inefficient, sometimes ineffective. It's certainly fragmented. And of course, it's expensive. In the United States, we also have the problem of an aging workforce. We have a problem that the healthcare burden continues to increase, that consumers and patients have different expectations, and also the cost of healthcare. We need to transform healthcare. We also need to be aware of the fact that globally, we also need to increase access to healthcare. And therefore, we strongly feel for this to happen, it has to happen from people that have the interests of the patient at heart. They're closest to the patient. And that, of course, is Mayo Clinic's sweet spot, because our primary value is the needs of the patient come first. So we're committed at a global scale to collaborate with others, to work with others, to strategically and purposefully invent the next generation of healthcare and do it in a way that builds not only on our history of ingenuity of innovation, but also now take advantage of all the new technologies that we didn't have a few years ago.
What are some of the strategies that Mayo Clinic is developing?
Well, in a way it's interesting because healthcare, perhaps for too long, has gotten used to the assumption that for true innovation to take place, it has to come from outside of healthcare. So we've gotten used to the possibility, maybe even a probability, that an outside entity is going to create a system that is sustainable, that it's affordable, that takes care of patients with complex and serious disease, as well as population health, and do it in a patient-centric manner. Now that's a heck of a challenge. And it's a heck of a challenge because healthcare is this unique blend of technology, but also humanity and emotions. And therefore, we do feel that for true transformation to stick, for it to last, it has to come from within the system, working, of course, with outside partners. And it has to have a dual goal. The first is to improve our current healthcare system. Our current healthcare system is not going away anytime soon, and there's still a lot of value to get out of it. And at the same time, create a platform for others to come and work with us and partner with us and with each other to create the new version of healthcare. And that's why we're in the earliest stages of creating a healthcare-centric platform that is built around clinical knowledge. It's a platform that will allow us to work with partners, but will also allow our partners to work with other partners, sometimes without even involving us. And that way we can create new medical knowledge, and that new medical knowledge will then create a virtuous cycle of innovation and value. This is really important for us. We're committed to this global collaboration. We're committed to working together so that together we can truly transform healthcare, but in a way that not only is meaningful, but also will last.
It's truly exciting. You mentioned both data and technology. One of the main themes here at the World Economic Forum is globalization 4.0 and shaping the future of the global architecture amidst the fourth industrial revolution. From your perspective, how do you see Mayo Clinic riding that wave of globalization?
Yeah, first of all, in the last 2, 3, maybe 4 years, technology has really advanced to a point where the basic infrastructure is there to transform healthcare. We now need a common platform where collaborators can come together. Globalization 4.0 is about globalization of services. And Mayo Clinic, as a service provider, knows that we have to do more. We have to be able to deliver our clinical knowledge and deliver it beyond our four walls. And that really was the genesis of the platform. A place where interactions can happen, and these interactions create new knowledge. We, at the same time, are committed to providing new knowledge. And then taking that new knowledge and work with our partners, using technology, and coming together so that we can truly bring a union of forces to bear on healthcare, so that we can innovate, we can reduce the burden of health, of the burden of sickness and illness, and at the same time provide better outcomes at lower cost that is more globally available.
The World Economic Forum is really a premier place for networking. It's also a premier marketplace and exchange of ideas. Tomorrow morning, Mayo Clinic will host a breakfast. We expect 50 business and thought leaders in that setting, all talking about making the case for big thinking and realizing the value of visionary investment. From your perspective, what's in store for that conversation? What do you expect?
Well, I expect it to be dark when we get up tomorrow because it's a very early breakfast. But I also expect us to be able to talk about something that is becoming more and more apparent. And this is the tension that exists between the here and now and where we want to go. It's always was there, but it's now more acute. It's now more acute because the cycle of change is now shorter, but importantly also the vector of change, where change is coming from, is less predictable. So as a CEO, as CEOs, our job is to look beyond the horizon, see where the world is going, see what we can do to get the things that we need to do to get ready for transformation of healthcare. That's fine, but it usually happens because of the shorter cycle of change, right at the time when your organization has just become comfortable with the previous change. That's a tension that needs to be resolved if we really want to transform healthcare, but really transform any organization. And that's what we'll be talking about tomorrow.
Can you describe some of the members of the panel and the insights they bring to the conversation?
Sure. As probably every panel ever assembled, it by default is the best panel ever.
Of course.
I think we have some data to back that up. So we have Dr. Peter Conway. Dr. Peter Conway is the current president and CEO of Blue Cross Blue Shield in North Carolina. He's a true expert in value-based healthcare, working previously at CMS in the United States. We also have Peter Lee. Peter Lee is a corporate vice president for Microsoft Health. He's a world expert. He's actually one of the initial people that worked on AI, and he's now using his knowledge to bring it into healthcare. And then we have Ken Kukier, and Ken Kukier is the senior editor at The Economist. He's written a book about data and technology, how it will transform our industry and other industries, and we're very much looking forward to what he has to say. Our moderator is Gregory Warner. Gregory Warner works at NPR. He's the host of a program called Rough Translation. And then last, and in this case least, there's me.
No, perfect. Sounds like a great opportunity, great insights. We look forward to what emerges from that conversation. We're going to turn to our viewers. If they have questions, we welcome their questions as part of this experience. No questions at this point. Gianrico, as you look ahead and you talk some about the platform opportunity, what excites you most about that relative to your experience in terms of Mayo Clinic's ability to best serve patients?
So what's exciting for me is how tightly linked this is to the legacy of Mayo Clinic. Mayo Clinic's founders were visionary. They created the first unified medical record, and they also created the first unified healthcare system. Now we have the technology to do exactly the same, but on a much broader scale. That's really exciting because that really brings together the union of forces that one of the Mayo brothers talked about and globalize it.
And what do you see as opportunities to partner with other organizations relative to this concept? What do you see in your mind? What's the potential?
Well, it's not a potential, it's necessary.
Yeah.
There's no healthcare organization that can do this alone. There's actually not even a group of healthcare organizations on their own that can do it alone. You need disparate partners that include governments, that include industry, biopharma, investors, and importantly, patients and consumers. Without the patient and consumer voice, you can create things, but they won't last, they won't stick. And it is only when you bring everybody together that then you get a transformation in healthcare. And that is indeed what the platform is about. The platform is really a space for these interactions to happen in an open and collaborative fashion.
While other industries have platforms, we haven't seen them yet really in healthcare. From your perspective, why haven't we?
Well, first of all, let me start why we need it. We need
Yeah.
it because of our patients, we need it because of our future patients, and we need it because healthcare needs it in general. It takes a place like Mayo Clinic that has collected data now for 154 years to be able to seed a platform. And seeding a platform is very important because then you have enough knowledge that you can then build on the knowledge. Furthermore, you need to have technology and you need to have clinical knowledge. And Mayo, over the last 10, 15 years, has built a unified data platform, which now is suited for us to import even more clinical knowledge into. And that's why we feel this is the right time to create this platform.
As part of your World Economic Forum experience, we're just hours into the World Economic Forum, but you're also speaking in several other settings. Are there other aspects of what you're bringing to the World Economic Forum you'd like to highlight?
Yes, so this World Economic Forum builds on last year's. This year it's about globalization. And when we come to healthcare, that is a significant issue. And so I'll be speaking at other fora about really high-tech solutions to healthcare that include things like precision medicine, regenerative medicine, the science of healthcare delivery, but then also at population-based health. And to be able to bring things together in a cohesive way is some of the things that I will be highlighting, and I've already highlighted at Davos. I'll also be highlighting the fact that it's darn cold in the morning, but it gets better as the day goes along.
Like most of the world.
Like
right?
most of the world, but yeah, but it looks like, high up in the mountains, it looks like it's a little worse.
Looks like we do have a question from a viewer. What platform that is currently in use at Mayo would best fit the globalization of technology in healthcare, as you mentioned?
Yeah. So I just had started mentioning what we call a unified data platform. It's a platform that brings in structured data. What we're now building is a platform that's able to take structured data, but also import unstructured data. The net result can be quite unexpected. We recently announced that a group of our physicians and scientists, using both the structured data from the unified data platform and natural language processing, looked at a simple EKG, an EKG that is cheap, easy to get, and were able to extract data from it to be able to predict who has asymptomatic left ventricular dysfunction that then could lead to congestive heart failure. Just in the United States, that affects about 5 million people, a $30 billion issue. And so you could see how using the combination of structured and unstructured data, you can get to answers in ways that you couldn't before.
Does this present opportunity to spread the knowledge across audiences, patients that previously didn't have access to it, including providers?
This is not only bidirectional, it's more than that. So we will learn at the same time. Mayo Clinic learns every time somebody uses something that Mayo Clinic developed, or when we work with a partner. So Mayo itself learns, and Mayo is able then to deliver better healthcare. Patients and consumers benefit from it because they get access to healthcare earlier and hopefully better. And then our partners, of course, gain from it because they gain both the knowledge, but also then hopefully the product that then can be used in the market.
We have another question coming. We know that there are many excellent, innovative ideas that come from the frontline staff, and we're just waiting for the rest of the question, and what they experience.
So I can guess where this question is going.
Okay, let's see if it actually is accurate. No, go ahead.
Over and over again, we learned that planning requires you to do two things. One is to have a strategic plan and then deliver on the strategic plan. And the second is to provide a place where others can innovate in ways that you do not expect. Our frontline staff, over and over again, have taken this to heart. Our nurses have come up with ways of decreasing pressure ulcers and injuries. Our janitorial staff have found better ways to keep our rooms clean. We're working with a company to find better ways to sterilize an operating room. And it's always our frontline staff that do this because they're the closest to the patient and they really do know what is relevant to the patient today.
Another question, how do you acquire and translate those ideas from staff that are busy with day-to-day patient care and ultimately operationalize those improvements? You've touched on that, but how do you make that real, and is it any different now in this greater application of technology?
Well, as some of you know, I'm very much into the fact that we need to find joy at work. And part of the joy at work is joy for ourselves, joy for our patients. You find joy when you contribute something meaningful. So yes, the day-to-day work is busy, but we are committed to be able to provide the right fora, the right environment so that innovation can bubble up. We can do it through structured ways like our Center for Innovation, RFAs, but then also by working with administrators to really create that safe space where anybody that has a good idea can bring it forward, and not every good idea is going to find a place, but every good idea deserves to be heard.
Just real quick before we close, you're 3 weeks in. What excites you about serving in the role of president and CEO?
You meant 3 years?
No, it's 3 weeks.
3 weeks. I see. Look, this has been, I've said it, this has been an honor and it's a humbling experience to be surrounded by people who want to do the right thing all the time. And to have this opportunity to lead an organization like Mayo Clinic is not something I take lightly. My commitment is to take these 3 weeks, continue to learn from them, listen, learn, and then make sure that we're really truly preparing to transform healthcare for the benefit of everybody.
Thanks so much for joining us this morning, Dr. Farrugia. And thank you, viewers, for tuning in. Stay tuned to the Mayo Clinic Facebook page for further updates on Mayo Clinic. Thank you very much.
Thanks, Chris. Thanks, everybody.